Excellent. Okay. All right. And if you have the opportunity, I think a couple more people are going to join. If you could please put your name in the chat for me. That way I can just take note of who attended and who we can send our feedback email to after this is done. All right, let's share this. Okay, so all right, so we're going to talk about dry eye. And with this Prevent Blindness Wisconsin, we kicked off last month with Cataract Awareness Month. Each month in the calendar year, we have a monthly observance on a different vision health topic. So this month is, for July, it is dry eye awareness, and that's why we have this workshop in place. And we also too have next month coming up, my colleague Shelby on this is going to be talking about children's vision health. And then September as well will be sports safety. So just some different topics for individuals to learn a little bit more on some other vision health topics. So a little bit about Prevent Blindness Wisconsin. I know many of us on here know about who PBW is, but just a general overview. So Prevent Blindness Wisconsin, we are a nonprofit organization. We are located in downtown Milwaukee, but we service the entire state of Wisconsin with preventative vision health services. So with this, we do it from cradle to grave across the lifespan. So we touch on children's vision health up to the aging eye, really trying to get public education, awareness on preventative vision health actions and how individuals can take control of their vision health no matter what age, if you have family members or if you are doing it for yourself. So we really try to incorporate education with that. We do vision screenings throughout the state. We are a staff of 9, so we could not do this work without our partners and volunteers across the state. So we partner with Wisconsin health departments to offer adult vision screenings, the Department of Public Instruction, school nurses, Head Starts, child care centers, free introduced clinics, and the Wisconsin Lions Foundation is a big partnership of ours too, to offer vision screenings throughout the state and also to follow up and referral education to make sure people are able to get into vision care. So rely very heavily on our partners and volunteers. This past fiscal year, we had a fantastic year, even with a pandemic happening around us. And we were able to serve over 14,000 Wisconsin residents with preventative vision health services. So that's direct services on getting into care, talking with them over the phone, one-on-one consultation. We have a follow-up rate of about 46%. So moving referred clients on to further care from a vision screening if they need that vision care from an eye care professional. Our adult and children's vision screening training courses are statewide, and we offer those virtually and a couple in person now. So we do offer those if you are interested in becoming a volunteer with us or a certified vision screener. And with this, we are very excited with this number. We have served over 400,000 Wisconsinites statewide when it comes to not only education, but just general awareness on preventative vision health. So we had a fantastic year, and like I said, our staff works very hard. We are in each county of the state, just really trying to spread our mission and vision and make sure individuals have that access and understanding to their vision care options. So what are we going to talk about today though with dry eye? So I'm going to go over the prevalence of dry eye. Basically, what is it? But two, it is a very common thing we're seeing. We do see it in the aging population and primarily in women, but we do see it more so now in those younger generations as well. And you can probably guess with screen time occurring. We're going to go over the anatomy of the eye, but also the tear duct system. So when it comes to the tears, why are those so important and how do those form and how do those drain out into the eye and then into the body? We'll go over, again, what dry eye is, common signs and symptoms, gonna vary person to person, but they are pretty standardized across the spectrum there, different risk factors, but also different prevention techniques. So if it is not artificial tears, are there other steps we can do, or are there more treatments that we can look into if we're really suffering from a lot of dry eye issues or signs and symptoms? So the prevalence of dry eye, With this, we have about 16 million Americans throughout the nation that are affected from this condition, and we do see those rates increasing. A lot of that has to do with individuals living longer, but also too with that constant exposure to electronic devices. Women are 2 times more likely to develop dry eye than men, and a lot of that has to do with hormonal changes, especially going through menopause. It is more common in adults 50 years and older, but like I said, we are seeing people of younger ages forming dry eye more frequently too. We have almost nearly half of American adults experiencing some type of dry eye symptom. Now, this does not mean it's diagnosed as dry eye, but there is either an irritant, maybe a gritty feeling, maybe it's burning. It's just not comfortable. So we have over half of Americans stating that they have some type of symptom of dry eye. Now, this one really stood out to me, but dry eye disease is one of the most common reasons for people to go in to seek vision care. And working for a nonprofit that is all about going in for regular eye exams, it's kind of a jab to my heart a little bit. But not waiting till we have symptoms or irritation with our vision health or notice change in vision, just going in regularly. But that is one of the main things why adults are going in now, is due to symptoms or just that uncomfortable feeling of dry eye. So going over the eye just in general, we've got a lot of moving parts here. The eye is pretty fantastic for us to see things clearly. So we have light that comes in through the cornea of the eye here. It comes in through the pupil, shines through the lens of the eye here, and then it's reflected on the back of the eye here called the retina, this thin yellow layer. On the retina that then sends all those light signals through the optic nerve. This is the main communication system between our eyes and our brain, and that tells you what you're seeing. So we've got a lot of moving parts going on here. The main area I'm going to focus on here, though, is going to be this cornea here. See where our iris is, the sclera of the eye, that's that white portion of the eye. And we're going to be talking about the conjunctiva and also to all of those tear duct systems we've got going on and how do tears form. That's essentially what dry eye is. So with dry eye, a lot of times we classify this as an inflammation or an irritation. Again, to that white area of the eye, you can see in this image, it's a little bit pink, a little bit irritated, the sclera. The eyelid might have some inflammation. We might have what's called blepharitis, which can be an inflammation or an infection to the eyelid itself. And even just the cornea itself is just not comfortable. We might have that gritty feeling. A lot of individuals say if they blink their eyes and they have dry eye, it kind of feels like sandpaper. Essentially with dry eye, what's happening here is we have an imbalance of tear production and the way those tears drain from our eyes over time. So there's 2 causes of dry eye I'm going to cover today. One is going to be the body does not produce the amount of tears we need to hydrate the eye and to keep that healthy and nourished, or we can have poor quality of tears. And we typically see this as individuals go through the aging process. So when it comes to dry eye, every time you blink, a tear is spread over your cornea, okay? Now there's 3 layers to a tear. I'm going to refer to this as the tear film. So again, every time you blink, a tear film covers that cornea. So you can see over here on this image on the right-hand side, we have our cornea here in that pink. And then these are the 3 layers of your tear film. So the very inner layer is the mucin layer, or we call it the mucus layer, okay? That causes that tear to stick to the eye. We then have the aqueous layer, which is more of a watery layer. And then the very outside is the lipid layer or the oil layer. So what's happening here is we have 2 glands working together to form this tear film. The lacrimal gland forms the mucin and aqueous portion, and these upper and lower meibomian glands, so these are basically glands that form on your eyelash line, the upper and lower eyelash line. There's about 70 meibomian glands on each eye, and that is going to form the oil layer of your tear film. All right, so every time you blink, these glands are working together to form your tear film. Tears then are drained out through what we call the puncta of the eye. It then goes into the tear duct, down through the nose, into the back of the throat, and then it can be recycled throughout the body. So again, for tears to be produced, you've got two glands mainly working together to form that tear film every time you blink. That tear film is important because that is what's typically keeping that eye hydrated. But that's when we start to see issues with dry eye come into play. So why are tears important for us? So like I said, you blink, we've got a new tear film. Perfect. So tears are important because one, they provide that moist layer, that lubrication to the eye. They also reduce our risk for infection. So if we have things, we've got things flying around our eyes all the time, that is a protective layer over the cornea of the eye as well. Tears also help us wash away debris in the eye. So if we get dust in our eye, if we have a mascara flake that comes off, eyeshadow, you can see it kind of pools up in the eye and you can wipe it away. Those are those tears working for us to clear that debris out of our eye. Tears also help keep the surface of our eye smooth and clear. So again, every time you blink, hopefully it is not that gritty feeling. It's that nice, smooth, fluid movement to, again, refresh the eyes. So the first cause of dry eye typically we see is inadequate amount of tears that our eyes produce. Now, this is very common as we get into 50 years and older. We start to see that tear production decrease. That lacrimal gland, but also the meibomian gland, sometimes they don't produce the amount that we need to hydrate that eye over time. Other medical conditions can influence tear production in the gland itself, and also different environmental situations as well. If we live in a very dry climate, that causes the tear to evaporate more quickly on our eye compared to maybe a more humid environment. We'll go into these a little bit deeper, but just want to give an overview of that. So the eyes aren't producing the amount of tears we need. The other area, though, is the eyes might produce tears, but they might be of poor quality. So remember I talked about that tear film. So each time you blink, we have that 3-layer tear film that forms over the cornea. So again, that innermost layer, that is going to be called our mucus or mucin layer. And this layer of the tear helps that tear stick to the cornea of your eye. That is going to come from the lacrimal gland. The watery layer, so the very inside layer of the tear film, comes again from the lacrimal gland, and that is called our watery or aqueous layer. That layer of the tear helps nourish the eye, gives it that, lubricated feel, and helps nourish that tissue of the eye. And then lastly, we have the oil layer. And here, this comes from what we call our meibomian glands. So the glands that line the lower and upper lash line. And this is like an oil layer. So we have oil glands on our eyelash line. And essentially, this is extremely important because this lipid or oil layer actually helps. That's that main barrier from those tears evaporating quickly. So we want those glands to be functioning. And we typically see dry eye symptoms come mainly from that meibomian gland not functioning like it should over time. We see that run very high in women and very high in women who are about 50 years or older. So again, that outside layer is going to help the tear from evaporating quickly. If the tear or the outside evaporates quickly, we then get down to the aqueous layer, which is again that nourishment layer. If that's exposed, that can evaporate. And then we just have the mucus layer. So that's why some people have that dry eye symptom if tears are not staying on the eye like they should. So like I said before, that meibomian gland, they classify this into what's called meibomian gland disease. So MGD for short, or they call it evaporative dry eye. Essentially, this is the leading cause of dry eye that we see. We have about 86% of cases of dry eye are due to this. So it's a very high percentage. So essentially what's happening here is the glands in our eyelashes here Those oil glands, they can either be clogged over time, or as we age, the body doesn't produce as much oil as when we were younger. So that can also be an issue as well. If these are chronically clogged glands, the body can just say to itself, hey, these are not releasing oil like they should. They're not giving that outer layer of the tear film like they should, and production can completely stop. So that's why if we have dry eye, we just want to make sure that we're monitoring it and seeing what the cause is early. So what are common signs of dry eye? Depends on the person, but a lot of times it's just that uncomfortable feeling. We might have a pink or very red sclera, or the white portion of the eye. It might be stinging and irritated. It might be gritty or feel scratchy. Sometimes it feels like there is something just stuck in the eye. Watery eyes is a symptom people question us on a lot with this. But if you don't have a healthy oil layer over the tear film, your other lacrimal gland, the one that produces the aqueous layer of the tear film, that's going to be in overdrive, and it's going to be continually trying to produce tears because they're evaporating so quickly. And that's why some individuals have watery eyes, because it's that overproduction sometimes. A stringy mucus near the eye, that might be due to infection or inflammation as well. And some individuals can have blurry vision. Sometimes people can suffer from vision loss from this if we don't catch it and find different treatment or prevention options. And a lot of times it is near vision that we do see being affected by this quite a bit. So what are our risk factors for dry eye? Well, for those ladies on here, I'm sorry, but for women, we are going to be at a higher risk. Again, we're 2 times more likely to have this, and a lot of times it's due to those hormonal changes. So when women go through menopause, when we have estrogen and progesterone working together, that can actually deplete, again, our testosterone level too, which we do need that for healthy tear production. Hormones help stimulate tear production as well. So if we have those kind of going wacky and wonky all over the place, those glands might not be producing those like they should. So elevating those at a healthy level. Women who are pregnant, we see them going through vision changes. Some might have to have glasses or experience blurry vision during pregnancy. That's due to the hormones changing. But the other interesting thing here is if women suffer from morning sickness, that can actually cause dehydration in the body, which then in turn can cause dehydrated eyes. And we see dry eye being linked with that as well for women. Use of oral contraceptives. So when we use oral contraceptives, again, it decreases our androgen or testosterone level in our body, which is needed for that tear production. So that can be a link to that as well. The highest risk for this eye condition is going to be women 50 years and older. Again, it's women and it's aging. It's kind of that double whammy. Women on hormone replacement therapy during menopause. So if it's estrogen only, that is a very high link with dry eye. It has to do with that concentration of estrogen in the body. It really kind of tricks the glands when it comes to that tear production, but it can also too kind of soak up that oil production in the other glands as well. The other thing I want to mention here is eye makeup. So if we wear regular eye makeup almost every single day, that is a lot on our eyes. Mascara, eyeshadow, eyeliner, especially if we don't wash it off at night, or if we're using makeup that is harsh for our eyes, that can really have a great effect. Sometimes makeup can flake off and get clogged in our meibomian glands, which then in turn can cause dry eye as well. So they say, just be aware of your makeup. If you put it on and you do have a reaction or irritation, take it off and throw that away. The other thing I want to mention here with makeup too is look at the expiration date, especially for eye makeup. On the back of your makeup, you should see that it says typically 6M on it in a container. That means that's good for 6 months, and then you need to replace that because we can have bacteria build up and we can have issues that can cause not only inflammation, but infections and then dry eye as well over time. Aging is another risk factor for dry eye. So with this, the older we get, typically we have a reduction in tear production in our glands. It's just something that is linked to aging. Also, the older we get, the less oil the body produces overall. So if we're not having that quality outside oil layer of our tear film, that's going to cause the tear to evaporate more quickly, causing irritation to occur more quickly as well. Certain medications can affect our tear production. So if someone is on antihistamines, decongestants, blood pressure medications, that can actually affect the lacrimal gland, how that produces tears and how that actually communicates with the body on how, if the eye does seem dehydrated or is experiencing that dry eye symptoms. Again, those medications can reduce tear production over time. So just take note, what medications are you on? That might be an influencer into that dry eye for you. Different medical conditions can really affect it. So rheumatoid arthritis, they say, diabetes can really affect, especially that tear production, but also the meibomian glands over time as well. And then if individuals have blepharitis, or sometimes you might get a sty maybe on the eyelid or eyelash line, that might be due to an irritation with those oil glands as well, and should be addressed just to make sure things are flowing like they should in the eye and with the tears. The other thing I'm going to mention here is failure to blink for long periods of time. We are in a digital world. The longer you stare at a screen, the longer you stare at your phone, that's less time that you're blinking and hydrating your eyes. So the longer time your eyes stay open, the more chance it has for that tear to evaporate and to cause irritation. I get it. I get very involved in my work too. Sometimes I'm here for 2 hours at a time, and every time I look away, then I know the eye strain. I know that they kind of ache. Well, if I have not been blinking for long periods of time, that could be it right there. So that is another big risk factor we see. They also are saying individuals who have had LASIK surgery done to their eyes, this can put them more at an increased risk for dry eye. So what LASIK is if someone has an astigmatism, hyperopia, myopia, a refractive error essentially. What they do is they can actually go in and reshape the cornea, because that is really what's affecting that light from getting in at that focal point into the eye. So they make a flap in our cornea, and once that flap is open, it's kind of like the opening of a book. Okay, so you open up that flap, they take a laser and they take that area and reshape the cornea. They then place the flap over, and hopefully that will do it where an individual does not need prescription or corrective lenses. However, the thing with LASIK though is the eyes change as we age. So if we get LASIK done at 30, maybe in our 50s or 60s or even earlier, the eyes change, especially if we're going through this digital world with, say, nearsightedness, the eye's shape actually stretches, and that can cause vision concerns where people need glasses even from LASIK surgery. So that is one thing I want to mention there. The other thing too is they are going in with a laser. So with LASIK and dry eye, they can actually cut into some nerves in the cornea, which reduces our sensitivity and can actually, that communication between the nerves and the glands of the eye, if that's not being communicated or they're not as sensitive as they should be, that's when the glands might decrease production of the oil and tears because it's not sensing that it needs it as much. So they are finding a link between LASIK and dry eye with those clients. With dry eye diagnosis, the biggest thing here is a dilated eye exam, discussing this with your eye doctor. We say adults between 18 to 59 years of age, if you're healthy, receiving a dilated eye exam every 2 to 4 years. 60 years and older should get one every year just because the eyes change so much. But essentially in an eye exam too, if you do complain of dry eye, the eye doctor might check the glands, the meibomian glands on the lash line just to see if there's any cloggages occurring. They can go in with what is called Schreimer's test, where they put these little pieces of paper on the inside of your eyelash line, and that measures tear volume. Typically it's a 5-minute procedure, and they just see where the eyes are and how many tears are being produced. They can also test the quality of the tears through different dyes to put in the eye. They have an osmolarity test where they look at the aqueous portion of the tear, see those particles that make it up, and see if there is anything that maybe we're lacking into. So they do have a lot of tests out there, especially if this is something that is really, really bugging someone. So getting into prevention techniques. So a big thing here is we see recommendations of using eye drops to relieve dry eye symptoms. So that can really help with just keeping the eye lubricated over time. With this, though, it is an acute treatment, but it is something that can really help just throughout the day, especially if you're trying to do near work or if you're working on the computer for long periods of time. Some eye doctors recommend just having those drops by you to refresh the eye. Using a humidifier in your home or a place of work, adding moisture to the eye. Again, dry climates can really evaporate those tears a lot more quickly. Some individuals applying a warm compress to the eyes, they say about 2 times a day for 10 minutes. 1, it can alleviate discomfort, but 2, if we have any oil glands on those eyelash lines that are clogged, it can actually loosen them up and can actually release that oil that should be there and protect those tears from evaporating more quickly. The other thing here, going into makeup again, so they say try to avoid applying products to the inner lash line. So if we use a tight line on eyeliner, try to avoid that. Just really can get into those oil glands, can clog them over time. Make sure you remove your makeup before bed. That is a huge one because it can flake off. And again, that can lead to irritation, inflammation. And if you use a hairdryer regularly, they say just try not to aim it at your face because again, that can cause tears to evaporate more quickly. So just small things we can do throughout our day. Eating for our eyes. So omega-3s are linked to really helping with dry eye symptoms. So you might hear someone saying or recommending taking a fish oil supplement. However, getting it through food is the best way. So fish, so salmon, cod, trout, mackerel, those are good food sources for this. Oils, so canola oil, flaxseed, those are really gonna help with that omega-3 in the body. Lutein and zeaxanthin. This is one thing I wanna mention here. A lot of people, when they think of eating for your eyes, they think of carrots, and that's great. Carrots contain vitamin A, and that's phenomenal for our eyes and our body overall. But this lutein and zeaxanthin, this is in those dark leafy greens. So spinach, kale, Swiss chard. This is actually one of the main food groups, I want to say, that they really promote for people for their eyes. It supports your retina of your eye, but it supports all eye health. And it actually, they really recommend this, not over, carrots or vitamin A, but it is something that they do see a lot of benefits with. Also, too, they say potassium can really benefit dry eye and those glands working properly. So bananas, yogurt, sweet potatoes, and staying hydrated. Like I mentioned with morning sickness, if our body is dehydrated, it's likely the eyes are dehydrated too. So staying hydrated throughout the day, they say about 8 to 10 glasses of water, 8 ounces a day of those. Oops, okay. So with this too, just making sure if we're outside wearing sunglasses when outdoors, protective eyewear, that can cause tears to evaporate more quickly. Avoiding smoke, that can just be a big irritant for our eyes over time. And then taking break from electronic devices. So we typically recommend the 20-20-20 rule. It not only helps with the onset of nearsightedness, but it can help with dry eye as well. So if you're doing 20 minutes of near work, so on a computer, on a tablet, a phone, after 20 minutes of work, look up and look at an object that is 20 feet away for 20 seconds. 1, it makes you blink more, and 2, it just helps the eyes reset itself, and it allows you to focus on something in the distance and use your distance muscles. And I know we are just getting on time here. I've just got a couple more slides. So with those of you that need to leave, I am recording this, so you can view the last couple slides, but I should be wrapping up within 5 minutes here. The other thing here is if, those prevention techniques aren't working, we can go in with more involved treatments. So if it does have to do with the oil glands in our eyes, what they can go in with, the eye doctor can go in with what's called a meibomian gland expression. And basically with this is they try to put warm compresses on the eye, and they might massage the eye to either help clear those clogs and those oil glands. And essentially what they do is they go in with this, a device where they put pressure on the upper and lower eyelid and lash line. And that pressure allows those glands to release any of those clogages, and opens them up more, allowing them to release the oil like they should. So that's a very common treatment we see. Otherwise, too, some eye doctors might recommend prescription eye drops or ointments. So again, the over-the-counter artificial tears, those are great. They're just a little bit more acute. So yes, they might hydrate the eye, but sometimes we have to take them a little bit longer. If we have a steroid prescription or an ointment or a gel, more of a gel-like substance, that just coats the eye a little bit longer and allows that tear to stay in and hydrate longer. Taking an omega-3 fatty acid supplement also too, along with foods that contain omega-3, can really help with tear production in the glands in our eyes. But if it does come to it and we just need to conserve those tears longer in the eye for them not to evaporate or not to drain as quickly, they can actually put in what's called a punctual plug. So they put that in the areas where tears drain out. And with that, they can keep them in long term, or they can take them out if they are irritating or they are, doing their job and don't need to be in there anymore. It just preserves the tear longer in that cornea sclera area a little bit longer for people. So that is it for dry eye. A lot of tips and techniques we can do to either decrease those symptoms, decrease that irritation, but if it does get to it too, there are treatment options out there. Our biggest thing here is, one, make sure we're going in for those regular dilated eye exams, and two, have that conversation with your doctor. Some individuals on medications, maybe it's adjusting the medication to help with that. Maybe it is a combination of adjusting our eye makeup, applying warm compresses, or it might be something a little bit deeper, looking again, typically at those oil glands that we see, but also too, where we are in life, our age, if we're going through menopause, different hormones are going on. There's a lot of factors in play here, but we can do things to really help decrease those symptoms and irritation over time. I want to share with you too, Prevent Blindness Wisconsin. We have a lot of information on our website for adult vision health, but also children's vision health. A lot of parent resources too, as kids gear up to go back to school. So we do have all of that on our website. And Prevent Blindness Wisconsin, with this, we do have a lot of social media outlets. So Facebook, Instagram, Twitter, LinkedIn. We do fun facts, whether it be dry eye, fun facts on children's vision health. We do informational, training alerts, educational alerts as well. So if you guys want to give us a follow, we'd love that. And if there are any further questions, I'm going to stay on for a couple minutes. I apologize. I know I went a couple minutes over 12:30 here, but any questions, please feel free. You can put it in the chat. My email is up here too. I am more than willing to, have a further conversation that way. Or if you're interested in volunteering or want any more information, please feel free to just shoot me an email, and we'd love to heir from you. So thank you for attending our dry eye workshop. I hope you learned a couple points or two on this, and we will see you in August, the third Monday in August, and Shelby will be presenting on children's vision health for our lunch and learn topic. So thank you, everyone.